I have a special interest in minimally invasive spinal surgery. I was fortunate enough to train under one of the innovators of minimally invasive spine surgery during my residency, so I had early exposure to the techniques. So I see patients frequently who are seeking a second opinion or have questions about minimally invasive options, and oftentimes we're able to offer a patient a procedure with a shorter recovery, shorter hospital stay, less expensive, and with less downstream negative side effects than they otherwise would have been able to have. I do take pride in providing patients with an excellent surgical outcome, but it's more important to identify the patients that don't need surgery and direct them in an appropriate way. Now, for me to offer a patient surgery, I have to be certain that that operation is going to benefit them with low risk and a high likelihood of a good outcome. That is the cornerstone of how we decide to operate on a patient with a spinal problem. I dedicate a large part of my practice to the care of patients with brain tumors. Those patients are particularly vulnerable because they're facing a new, significant diagnosis. It's a very scary time for patients and their families. So it's important to me that they understand their diagnosis, what that means for them, and help them understand how we can help them from a surgical perspective. And often that's in a very significant way. I also have come to realize over the years how important the physician-patient relationship is, so that it's not only important for me to technically do good surgery, patients have to understand what they will experience. And my happiest days, or my most satisfying days in this profession, involve seeing patients who've gone through that process and have them tell me things were just as I thought. You explained things very well. I'm very pleased with how I feel now.